Okay, good evening, everyone. It's a few minutes after 6 o'clock. My apologies for the delay. We're going to get started. So I want to welcome everyone to this evening's general meeting of October 28th. It's approximately 5 after 6, so we're going to call the meeting to order. We have the council attendance. We're going to observe a moment of silence. We'll accept the agenda. I'm going to read the rules of order. We do have a couple of follow-up items from September 23rd general meeting. We're going to provide an update presentation on as a COVID update from the Department of Health, as well as AMBE. We're going to give a presentation on the fuel allotments. Every year we do a Akwesasne heating assistance program. We're going to give an update for Halloween in relation to COVID, so that we're sharing information. People are conscious of how to safely trick-or-treat. And we'll give an update on the holiday dinners that we generally have every year. I have a resolution that needs to be read into the record, and then we'll make announcements for the next meeting dates. So that is the agenda. Could I have a motion to accept? Moved by Dwayne, second by Julie. All in favor? All right, thank you. It's carried. Okay, I believe all members are in attendance this evening, so thank you for that. I do, before we proceed any further, want to just observe a moment of silence. We have in the past, when we were meeting in person, we had a general meeting cancellation protocol, which simply said that if a death occurred in one of the districts, we would relocate. Obviously, since COVID, we're not having in-person meetings at this time. So in recognition of those members that we've lost since our last general meeting of September 23rd, I do want to observe a moment of silence for them. So I'll ask for that now. All right, thank you very much. And on behalf of myself and council and the Mohawk Council of Akwesasne, we extend our deepest condolences to all the families who have been affected by loss over the last month. So I will read our rules of order for this evening's general meeting. So again, we are using the Zoom system. Our meetings generally occur on the last Thursday of each month. The meetings start at 6 p.m. and go to approximately 8 p.m. If at that point we will take a time check to see if there is a need to continue to go further. If there is, we will do that. If not, we can reschedule to the next general meeting, but generally we want to keep it in between that time. This is what we will consider a public forum, so we ask that private personal matters not be dealt with in this forum. We ask that if you have a personal matter, that you make arrangements to speak to myself, one of our staff, or one of the members of council to address that on a one-to-one basis. As well, these meetings are recorded and made available to the community who's not joining us this evening. So as well, we want to make sure that we protect people's privacy. If you have a question or comment or concern about an employee of the Mohawk Council, we ask that you please not address their name directly, use their position or in general terms, because they're not here. And this is a public forum. So again, all personal matters are to be dealt with on a one-to-one. Since we are using the Zoom system, I ask that you please raise your hand or unmute yourself and acknowledge that you want to speak. We need to still maintain a speaking order. I will make a note and call upon you when it is your turn to speak. So please, please respect that. As well, we ask that you please keep your questions and comments relevant to the point of the discussion that we're having so that we can continue to move through the agenda. As well, we ask that everybody please remain respectful to one another during this meeting, to myself, members of council, and other community members. If for whatever reason that people are being disruptive and disrespectful, we will remove them from the meeting, and that we will take them off of the Zoom system. As well, any items that we can't address or questions that are need further follow-up, we will make a running list of follow-up action items for the next general meeting and report them back to you. So again, that is our rules of order for tonight's general meeting of October 28th. Thank you to all of you for joining us this evening. So the first item that we have is to go through the follow-up items from the last general meeting. So the question that was raised is, are there terms of reference for all of the committees? And we are following up on generating a list of the committees, but also the terms of reference available for them. So that hasn't been, the report is not ready yet, but we are in the process of generating that. There's the second question was asked whether or not the police commission can start meeting with the community. So I'm going to go to a public safety portfolio chief, if we could, to just address that question, please.
Thank you, Grand Chief. The police commission, the last meeting that was scheduled had been canceled. And at the next available meeting, we will bring that forward. In the past, there had been a invitation for, I believe it's the first 30 minutes of the meeting, but I will double check with our police commission and report back. Thank you.
Thank you very much. So again, the police commission meets once a month. We will follow up. They didn't have a meeting since our last general meeting, unfortunately, so we were not able to action upon that and bring that to them, but we will report that back. So let's keep that follow-up item on the follow-up list until we're able to provide us a concrete answer. Okay, so we will go into our first presentation, which is part of the COVID. As you know, we continue to grapple with the COVID-19 pandemic that we're dealing with in our community and across the globe. We think it's important that we continue to keep the community updated as to where we're at within the Department of Health. So I will go to, if I could get the presentation up, and then I'll ask Chief Tim Thompson to begin walking us through that. He will hand it off to Chief April Adams-Phillips halfway through the presentation. So Tim, we'll go to you.
Good evening, everyone. I want to first of all recognize all of our health staff, our frontline workers, our administration, the doctors, the nurses, and all the people in the office doing the backlog of all the work that has to be done. And we applaud them for all of their hard work at this time. So the Mohawk Council of Akwesasne COVID-19 vaccination statistics update, October 2021 general meeting. COVID-19 tests administered. The community health program has administered 2,274 COVID-19 PCR nasal swab tests. Community health averages 35 to 55 tests a week. Turnaround time for results is 3 to 7 days. This is dependent on the lab testing the samples. MCA programming has no control over testing results or turnaround times. COVID-19 test days are on Tuesday and Thursdays. More days will be added based on demand, and they are being held at Akwesasne. Community Health has administered 4,437 vaccines, first and second doses. Ages 18 plus, 2 doses administered, 2,135, Pfizer and Moderna. Ages 12 to 17, 2 doses administered, 116, Pfizer. Elders and vulnerable population are given priority for vaccine clinic dates.
Community vaccination rate for MCA jurisdiction. Vaccine rate for MCA jurisdiction population is 28.55%. Vaccine rate determined by the fully vaccinated individuals, 2 doses, 2,251 people times population base used. So 7,882. Upcoming COVID-19 vaccination clinics, October 27th, 2021, 10 a.m. to 12 p.m. And it's Pfizer. And this will be held at Akwesasne Health Facility by appointment only. The next date, November 10th, 2021, 10 a.m. to 12 p.m. And that's Moderna at Akwesasne Health Facility by appointment only. Vaccine clinics are currently held every other week. And again, Yawangoa to our community health nurses. A big Yawangoa to our community health nurses and staff for all their hard work and dedication to our community throughout the pandemic. They worked tirelessly over the past year and a half to ensure that the health and safety of our community. And I'd like to thank them also. And please be patient and kind. It's been a tough 2 years. Yeah.
Okay, thank you very much for that update. Are there any questions in relation to this presentation? Yeah, go ahead.
I don't know how to put my hand up.
That's okay. You can go ahead and ask your question.
Never did. Of the,
You keep cutting out on us.
I'm sorry, of the vaccines that are administered, it says 28.55%. My question is, do those numbers also include like a lot of our, a lot of the, let's say, northern residents went and got their shots on the American side at the IGA? Does it include those as well?
Yes, it does. For what we
It's giving you all the numbers, Abram?
say that again.
They've given you all the numbers of the residents on the in the jurisdiction of the MCA?
Of what I have identified as living on the Canadian portion, yes. So the whole numbers issue continues to be a bit of a challenge for us right now, because what we're going off of is what is administered by us or what has been declared at the Same Mohawk tribe as being a northern portion resident. They'll let us know. The challenge that we face, though, is that we don't have data that says how many people actually live within the community. We have an ideal of what that is. So the percentage that we're reporting in that report is actually based up against Indian registry number.
Okay.
So we are we're undertaking an exercise to try to narrow down what that on reserve number is, so that we can have a better better projection of how close of a real vaccine rate we are at.
Are you looking at doing some kind of internal census
Yeah.
to be able to our numbers and everything?
Yes, basically that. Yes, I mean people get shy over the language census, but we are looking at doing a exercise whereby we will capture how many people live in households, so that we can have a better accurate number.
And the other piece is, there's a number of people that went to like Walgreens, Kinney Drugs, and other drugstores in Ontario, and potentially Quebec. Are we getting any of those numbers? Are people self-identifying themselves as having done that? So that, and has there been any effort on the part of MCA to try to get those numbers too?
Yeah, so the Ontario we definitely would get. Quebec, I don't believe so, but I'm going to take a bit of a wild guess. I don't think it's very high at all. But once we get a better understanding of what the population number is on reserve, then we could look at doing an exercise whereby people would self-declare, so that we can reference it either to the data that we have or put them on kind of a registry of being vaccinated.
Yeah, okay, thank you.
Thank you. Are there any other questions in relation to that presentation? Okay, thank you very much to the two of you. We're going to go to the second presentation, which is the AMBE's protocol COVID update. As you know, the education system has been changing last year to accommodate the COVID pandemic. We feel that it's important that we continue to share that information with the community for all of the families that have children within our school system. So Chief Julie Phillips Jacobs is going to walk us through this, followed by Chief Sarah Dybel, who will assist, and also Chief Edward Rompoint will assist. So Julie, we'll turn it over to you to start us on this.
Good evening, everyone. So the Akwesasne Board of Education, this is their community update for this month of October. So at AMBE, safety is our first priority. It's important to note that AMBE is proactive in monitoring and closing classes as required. To date, there has not been any spread or no spread of COVID within the schools. AMBE schools have smaller class sizes for all students, and we are providing classrooms with desk shields and extra PPE. Parent support, treating everyone with kindness. We realize that it is not easy for families to navigate the changes due to COVID protocols. Everyone is doing their best to understand all of the requirements for isolation and return to school. Each case is different, and we ask that everyone be patient while we consult with health experts. This partnership will help us keep everyone safe and allow learning to continue. Together, we can close the gaps that were the result of the closure caused by the global pandemic.
AMBE Protocol Update. AMBE consults with community health and values their guidance as we are educators, not medical experts. We will ask families to keep children home until they can be cleared to return by community health. We ask that if children are sick, they remain home and the parents consult with community health. Children should only return once community health clears the child of isolation protocols. We are asking, based on the COVID screening tool, that if someone in the household is sick or been directed to isolate, that all household members remain home until directed otherwise by community health. Each case is unique, so the protocols for isolation can vary. AMBE PPE update. In consultation with health in the ministry, it was recommended that everyone wear the 3-ply disposable masks as they provide better protection and can change throughout the day. AMBE is providing masks at school for students and staff. We also provide shields for students and staff. Parents who want their child or children to wear a cloth mask may do so, but they must also wear a shield for extra protection. We continue to provide opportunities for social distance mask breaks. Examine our options. AMBE contacted families to discuss the options listed below. 1, high school to grade 2 at school 3 to 5 days. Option 2, grade 3 to 8, hybrid, 2 days in school and 2 days online. Option 3, continue with everyone in school. Option 4, reduce days in school, Mondays off for weekend tracing.
Survey results. 92% of the families voted for remaining in person 5 days regular. 8% of families voted for online only as a first choice. In reviewing the safety measures in place and the benefits of having children in school, it was decided that AMBE will continue in-person learning for the time being. We will monitor closely and collaborate with health. Children from K-5 to grade 8 all have access to Chromebooks, and staff are ready should we need to transition. Ohio updates. Classes continue to be offered on site. Screening protocols are in place and PPE is required by students and staff. Classes are small and dividers, desk shields, and face masks are available. Ohio is prepared should they need to transition to remote learning. Students attending Ohio were also offered laptops if needed. To date, Ohio has had no closures in the post-secondary programs offered on site. Ohio has just launched the new welding program cohort on site as well. Childcare updates. Childcare continues to increase capacity at each center. Staffing is a challenge as ministry guidelines require specific numbers of staff, and with isolation protocols, we do not always have enough staff to increase capacity. Rapid self-testing has begun for all non-vaccinated staff. Childcare is in compliance with all licensing requirements. Please do not send your child if anyone is sick in your household, as we know how important this service is for working families, and we are striving to remain open. 0 to 6 program continues to offer remote services to families. Nyawo parents and families, please monitor our Facebook page for regular updates. Nyawo.
Thank you for that, Julie, Sarah, and Edward, for the presentation on that. I will say that AMBE is, as well as a number of other programs within the MCA, having a hard time attracting people to the positions that are open there. We do desperately need substitute teachers, as well as bus drivers, sub-bus drivers, and bus monitors as well. So if you know anybody that is interested, please encourage them to reach out to the Akwesasne Board of Education to discuss some of those options that we have there. I'll take a moment now to see if there are any questions in relation to the PowerPoint presentation on the Board of Education.
Can I jump in?
Yep, go ahead.
I think it was Edward's, Edward, did you do the child care piece just now?
Yes.
There was something in there about rapid self-testing has begun for non-vaccinated staff. Did I get that right?
Yes.
Yes, that is correct.
Is that part of the, vaccine protocol that MCA came out for the rest of its staff? The COVID vaccination policy, I believe it's called, something like that.
Yes, I believe it is somewhat similar to the same one MCA had policy that we had put in place. AMBE had their own policy put in place in regards to the teachers that I believe were non-vaccinated. So this is part of the protocol they have to follow.
So I'll just jump in there really quickly. So the child care center is falls under the ministry, so it's regulated. The ministry has dictated that staff have to be vaccinated, and if they are not, they have to be tested regularly. That was in place prior to the MCA implementing that. The other facility that applies to as well is the long-term care facility, Junkanusade, is also ministry mandated that testing has to occur regularly. That was happening there as well prior to the MCA putting in updating our policy or a directive saying that staff have to be vaccinated, and if they are not, then they will be subject to regular testing and have to also participate in an education program.
Okay. That's awesome that we're doing that, but just a quick question is the new MCA policy, which seems to be very similar, like you said, to the ministry policy. The new MCA policy says that for people to be tested, that they have to pay for that. The employees have to pay for that themselves. Is that the same requirement or obligation for childcare staff and Jungwanusa staff?
At this point, nobody is paying for it. It may come to that point where they are, but all of those staff are not paying for it at this point. And there was, I'll just say that we are not the only organization that is doing this. I know that a number of organizations that we work with, including the federal government, has made vaccines mandatory for the staff. If not, the processes in which we are following are very similar, meaning that they have to be tested and have to take part of the training course. I know that the Ontario government has released a plan just recently saying that over the next several months into 2022, that there will be a phase out of a number of policies. And I can tell you that they've gotten a lot of pushback on that because contrary, the Ford government in Ontario does not have a crystal ball. So we don't know where we'll be in March. So while these policies are in place now, if COVID is eradicated from essentially, I will say North America, we may at that point take a look at reevaluating these requirements, but we'll obviously rely on the health professionals, not only locally, but nationally as well, because keeping our employees in our community safe is the #1 priority for us.
Of course. And I think the community expects nothing less from the Mohawk Council of Akwesasne. But getting back to the COVID policy, okay, one of the things that has always been a fuzzy area is AMBE. People who work for AMBE, are they also considered MCA employees?
Yes.
Okay, and if MCA employees are now under this new COVID vaccination policy that requires them, like I don't know, you guys passed it by NCR, so you must have read it and looked at the policy itself, examined it. Maybe some even had part in developing it, but it says that people who are not fully vaccinated, just like you said, have to be tested on at least a weekly basis, and that they are required to pay for that testing on themselves. Are you going in a different direction than that?
Well, understanding that this is obviously new to all of us, there is, it is implemented, but I mean, some of the finer details on, paying for it is still to be worked through. At this point, we do know that a number of people who are previously not vaccinated have gotten vaccinated now and are working through getting the 2 shots. So, as all policies, they can be amended and rescinded as needed based on, what's required of the policy itself. So we're not, no employee at this point is paying for the test. But if we are 6 months, 8 months down the road and still, having to test employees regularly, it may be different at that point. But as of right now, no, nobody's paying for it.
Do you have an idea, Abram, or somebody, like the percentage of MCA employees that are vaccinated and then unvaccinated?
Mm-hmm. We don't have the exact number as of right now. We are quite high in most areas. Some are not as high as where we'd like to be, but with this policy's implementation, again, it has changed. But we can mark that, and we'll report that to the community and yourself once we collect that information. We don't have it right offhand.
Thank you.
Okay. All right. Thank you very much for the presentation and for the questions on that. We'll now turn to the next presentation, which is the Akwesasne Heating Assistance Program. As you know, every year the Mohawk Council has provided some assistance to heads of household within the community and within the jurisdiction of the city of Cornwall, or the boundary, excuse me, the city of Cornwall. That program will be rolled out again this year, and this presentation will provide you with an update on that. So I'm going to ask Chief Vanessa Adams and Chief April Adams Phillips to walk us through this next presentation.
Thank you, Grand Chief. We would like to express our thanks to the Community Settlement Fund for their support in providing funds for the Akwesasne Heating Assistance Program. 2021-2022 Akwesasne Heating Assistance Program. The Mohawk Council of Akwesasne would like to inform the community that the Akwesasne Heating Assistance Program will once again be offered for the upcoming 2021-2022 winter months. Your eligibility criteria. The eligibility application process now includes Akwesasne who are residing within the municipal boundary of the city of Cornwall, Ontario. The applicant must be a registered member of the Mohawk Council of Akwesasne under the Akwesasne Membership Code. The program is also extended to clients of the Community Support Program. Application process. Applications from last year are now being reviewed over the phone with community members. Due to COVID-19 pandemic restrictions, you do not have to fill out a new application again for this year. This will be done automatically by staff of the Community Support Program based on your previous year's information. If you applied last year, a staff member from Community Support Program will be in contact with you, head of household, to verify your application. Community Support Program will ask if you wish to remain with the same heating source payment, or should you wish to change to another provider. This information will be updated. New applications. If you are a new applicant and have not yet applied for the Heating Assistance Program this year, please contact the Community Support Program. If you have not heard from the Community Support Program to verify your application, please reach out. We may have missed you and want to ensure that your application is updated. Please call our office directly at 613-575-2341, extension 3262, and we will be happy to assist you with the application process over the phone. 2021-2022 funding for heating assistance. If you are age 59 and under, the heating assistance amount will be $500 per eligible household. If you are an elder, age 60 years and older, the amount will be $800 per eligible household. And I'll turn it to Chief April Adams Phillips. Now.
Thank you, Vanessa. For the approval process, once your application is approved, your name will be provided to your heating source provider as per your information. The allotment will be credited to your heating provider account accordingly. Application verifications from last year are now being confirmed by phone, effective with the release of the communique to the public under Mohawk Council of Akwesasne. Deadline for all applications for the heating assistance. The final deadline for applications will be Friday, December 10th, 2021. Again, that date is Friday, December 10th, 2021. There will be no exceptions after the deadline, as the fuel distribution will commence at this time. Now, the Community Support Program. There you go.
All right, y'all, the two of you for walking us through that. So again, this is a regular program that we have provided annually to the community. With COVID, there will not be an intake per se. If you applied last year, they'll be contacting you in the near future to verify. And we expect to have distribution sometime the end of November, the beginning of December. Are there any questions on this presentation? Yeah, go ahead, Vince.
Yeah, I just want to ask the presenters to maybe give a scenario. If you haven't been contacted and you filled out a application the prior year and you're waiting from the call and the deadline has passed, will they still honor that application information? Because you weren't called upon after the deadline, or if the person reaches out to them after the deadline and say, I wasn't contacted, and they had submitted something the following year, and then move on from there.
I can adjust that if you'd like. We encourage community members, if they have not been contacted, please call 613-575-2341 extension 3262 to verify your application. So if you feel that you may have missed the call, please do not wait till the deadline. The presentation did state that is the final deadline. So please do not wait until that date to call or to call afterwards. I encourage you to call ahead of time just to verify your application, or if you may want to change from, say, your electric source of heat to a fuel or propane source of heat. So I encourage you to call ahead of time if you feel that you've missed the call from Community Support Program. Thank you.
Thank you for that. So I just want to take a moment to address, we have received earlier this, well, actually, in fact, last week, and in the past, we have received calls from community members who don't live within the reserve boundaries, but live outside of the Cornwall boundary. So people who live within the said portion of the city of Cornwall are eligible for this assistance. People who are outside of the boundaries of Cornwall are not eligible for this assistance. Recently, council brought this forward for debate, and at this time has determined that for this year, the 2021-22 heating assistance year, we will not be expanding those boundaries outside of the Cornwall city limits. So you must live within the community or within the Cornwall city limits at this time. So we will continue to keep that in place and rebase again, either over the summer months or next year. So that's a question that we've been asked. We've been asked annually, and we've determined that this year we will not be. So I wanted to make sure that we're sharing that with the community. Okay, thank you very much to Vanessa and April for the update in relation to the Akwesasne Heating Assistance Program. So the next update, we wanted to share some information with the community. As we know that just under a few days from now, Halloween will be taking place, which is a great holiday, which many of us and our youngsters participate in, but we feel it's important that we share information with you in relation to making sure that as we go about trick-or-treating that we're remaining safe. We still continue to be in a pandemic and are at risk of transmission of the COVID virus. So we want to make sure that people are aware of that. So we're going to share a few updates and information in relation to that. So I'll go to Vanessa again to walk us through this presentation, and she'll be assisted by Chief Sarah as well.
Thank you, Grand Chief. Halloween 2021. So our Department of Health guidelines are recommending to stay home if you have symptoms, remain physical distancing, trick or treat outdoors as much as possible, keep interactions with those handing out candy very brief. Our Emergency Operations Center has recommended some Halloween safety guidelines. If you're handing out treats, please keep at least 2 meters distance from trick-or-treaters and wash your hands often. Use hand sanitizer. Pre-make candy bundles or bags, and space out on the table, or to find other creative ways to hand out treats while maintaining a distance. If you or your child are sick or self-isolated, please do not go out trick-or-treating or hand out any treats. Anyone with even a mild illness should stay home and refrain from going out. Stop the spread. Chief Sarah, if you want to continue.
Sarah, you're frozen.
You're muted.
Sorry. Additional tips for safe gathering. If you're unvaccinated or not fully vaccinated, book an appointment for COVID-19 vaccine as soon as possible. Wash your hands thoroughly. Virtual gatherings remain the safest option. Outdoor gatherings or events are safer than indoor ones. Small gatherings have a low risk of COVID-19 transmission. Halloween candy slide and decorating challenge. Please submit your photos of your decorated house, lawn, and/or a DIY candy slide shoot to communications@akwesasne.ca. Please identify your name and district which you reside when submitting your entry. Prizes will be randomly drawn live on MCA's Facebook page on Friday, November 5th. Pandemic-friendly ways to hand out candy. Treat bags, Dixie cups, long kitchen utensils, bowl with hand sanitizer, Halloween candy shoot. We have candy, trick or treat, keep 6 feet of distance, and don't forget the hand sanitizer. These are signs that you can use to know that you're participating. Here's one that, sorry, no candy signs. Let's trick-or-treaters know your house is not participating in Halloween this year. Recreation Center Halloween events. Each district recreation center has advertised the events they are holding. The next slides are here for your reference. This is for Ganadago, St. Regis Village, October 31st, 2 to 6. Please take all safety precautions. Go to houses you know. Don't travel in large groups. Social distance 6 feet. Chances for door prizes at different resident houses. Be safe and happy Halloween from the St. Regis Recreation. Goanoge Recreation presents Golden Skull giveaway. Old school trick-or-treating Goanoge style. Skulls will be handed out in candy bags. If you're lucky winner of a skull, you win some awesome prizes. Prizes can be picked up at the Goanoge Recreation Center Monday, November 1st from 5 to 7 p.m. Snyder Recreation Trick-or-Treating. The Sny Recreation will once again be coordinating trick-or-treating for the district this year. The Sny Recreation will be a stop on Halloween stop for a chance to win a door prize and also take a guess at our candy guessing game. If you will be participating in Halloween this year, please put out your sign given last year or pick up a new one at the recreation on Halloween morning from 10 a.m. to 1 p.m. Have your name added to the map that will be provided by sending a message to KRONHIENTH Arquette at the Sny Recreation on Facebook. Leave your name and address, or the Sny Recreation on Facebook. We understand that during this time, some families have loved ones who are compromised and do not want to take a risk and would not like to participate this year, and that is understandable. We once again encourage families to set up outside of your home so that trick-or-treaters do not have to go into homes. We are recommending trick-or-treating take place between 2 p.m. and 6 p.m. If you have any questions, please feel free to contact the Sny Recreation at 613-575-2496. Have a safe and happy Halloween. Happy Halloween, Yawa.
Thank you very much to Vanessa and Sarah for walking us through that. It's important that we remember that we need to be safe as we hand out candy or as we take our children or our grandchildren or what have you around the community. Vanessa, we'll go to you.
Yes, and I'd also like to inform the community that our communications department has developed and created a special edition Ongwedage, which has all the Halloween information and the signs to put up. And we'd like to thank our communications team for doing that. Thank you.
All right, thank you very much for that. Are there any questions in relation to the presentation? April, go ahead.
I'd just like to add that the special edition of Ongwedage for Halloween has been delivered to the mailboxes, and the flyers are inside the mailboxes for the inside the Ongwedage for to post.
Absolutely, thank you for that.
I just
Okay.
aware as well that the Coalition for Community Empowerment is having trunk or treat, a drive-through trunk or treat tomorrow night from 5:30 to 8:30. And I think they start on McGee Road, go down Margaret Tourette's Way, is it called? And they would come out on Route 37, 5:30 to 8:30. Thank you.
All right, thank you very much. And those of you that didn't hear that, because it was a little bit low, tomorrow evening, 5:30 to 8:30 on McGee Road, Margaret Touret's Lane, the Community for Empowerment organization will be having a trunk or treat. Okay, thank you. All right, we're going to go to Chief Dwayne Thomas, who's going to give us an update on the holiday dinners. So every year we've had the Christmas dinners, except for last year we weren't able to because of COVID. So obviously with Christmas chugging along and coming closer, we were looking at what some options may be. So Dwayne, we'll go to you for an update on that initiative.
Thank you, Grand Chief. We've had a number of meetings, our holiday dinner committee. And because of the rise in cases of the last couple of weeks, we've decided that in lieu of holiday dinners, the chiefs and Grand Chief will be going out for a designated time, and that time hasn't been chosen yet. And we'll be going door to door, handing out a special gift yet to be determined. So once at next month's meeting, we'll have more information on that when we nail down all of our details, and I'll give another report next month. Thank you.
Thank you very much. So there is planning happening. All the final details are not ready yet, but we will be making an announcement. We just want to let people know that there will be a door-to-door. It will not be a traditional meal at a location as we have done in the past. Okay, Vanessa, I know that we have received a question ahead of time. We have received a few questions this evening. Unfortunately, we're not able to address ones that come in very late. Some come in much earlier. What we will do is put them on for the following general meeting, but there was one in relation to public safety. So Vanessa, on behalf of public safety, if I could go to you for that.
Certainly, Grand Chief. So we did receive a question in relation to community policing and what the definition of community policing is. The International Association of Chiefs of Police presents a community policing definition that integrates three essential parts: partnerships in the community, problem-solving approaches, supportive organizational structure. Community policing is a shift from traditional policing and focuses on building trust and long-term relationships in the community with the goal of reducing crime. It moves from a punitive focus to one based on prevention through mutual respect. The Akwesasne Mohawk Police fosters a sense of safety for community members and supports the ultimate goals of policing by increasing the visibility of our patrols in the community and on the waterways. According to the Canadian Association of Chiefs of Police, the cornerstone of the profession is trust, accountability, and support of the community. Some key aspects of community policing include consultation approaches, proactive strategies such as newly implemented community watch programs that AMPS has assisted with, alleviation of fears, flattened administration, emphasis on responsibility. More simply, community policing is all about integrating police agencies more closely with the communities that they serve. Earlier this year, the Akwesasne Mohawk Police Executive Leadership Team met to discuss the need and process of revamping our community service model. But due to the COVID-19 pandemic, plans for a call out to the community members who would like to participate in an advisory committee was put on hold. We are hoping to have this underway in the spring of 2022. The advisory committee will be created to assist AMPS in creating a more tailored community outreach program. It will be community-based consultation approach. The approach will give community residents a seat at the table and collaborations with partners such as community health, social services, justice, and child and family services. To increase communication with the community, and the AMPS has trained several officers in media relations and works closely with the MCA Communications Department to increase our presence on social media and respond to media inquiries in a timely manner. Police officers today must often address social issues such as mental health and addictions. Therefore, it is paramount to look for opportunities to orient and connect people to services that coordination can mitigate risk. To assist with this, the AMPS has assigned an officer to act as a mental health liaison. This officer works closely with families to assist them in addressing mental health issues to avoid future negative police interactions. Also in 2020, as the COVID-19 pandemic swept the globe, the Canadian leaders advocated for a refocus on community policing principles. Since community policing anticipates and adapts to the needs of the communities, the practice is vital for emergency response and will be a top priority for police services in 2022. Calming fears has another important aspect of community policing. During this crisis, when emergency stay-at-home orders, curfews, and other restrictions were put in place, AMPS focused on community education related to their designated powers rather than ticketing every individual they intercepted. While on patrol, increasing the visibility of marked units on patrol throughout the community was also an important aspect of calming fears within our community. Since Chief of Police has taken on his responsibilities here in Akwesasne, he has been making changes. Some may think these changes have been needed, others may be hesitant. Having said that, AMPS is still undergoing a lot of change. Thank you very much.
Thank you very much, Vanessa, for relaying that information for us.
Maybe we can get that information in minutes or something.
Yes, we can. We'll take that extraction and we'll send an email tomorrow with the material, and we'll make sure that that's included in there. So Taylor, can we make sure that that's noted and we'll send that out?
Who is the mental liaison?
Pardon?
Do you know who the mental health liaison is?
You know who the mental health liaison is?
No, I don't, but I will find out for you.
Okay, thank you. Okay, so we're going to stop right there. Are there any other questions in relation to what was presented? Are there any questions, Vanessa, Vincent?
On that topic or any other topic?
Well, we'll open it now for any at this point.
Okay, thank you for picking on me, Adam, because I didn't have my hand up, but you know.
Your mute went off, so I thought maybe you did.
No.
Okay.
Okay, I just have a few of them, if you don't mind. Can you hear me?
Okay. Yes, we can.
I've got my voice right next to the computer. I just wanted to know, are you pretty much complete with the council orientation activities?
Yes, for the most part, yes. We will be going into strategic planning next week.
Okay, and wanted to know too, as role models in the community, council chiefs, are all council chiefs fully vaccinated?
I see many heads nodding yes. Everybody's thumbs up there. So we do have a couple of policies, right? I mean, that the staff have to be vaccinated. While council is not staff, leading by example is extremely important, but as well, we now have passed the resolution that participating in meetings within the MCA, you must be vaccinated as well in public spaces. So that requirement will also apply to us as well.
Awesome, and that brings me to my next question. Thank you for the segue. I have in front of me all of the policy that you're speaking of. Therefore, be it resolved that the MCA shall require proof of double vaccination be verified at any public event held within Mohawk Council Akwesasne facility and effective immediately. In the submission form for that resolution, at the end of it, where the section where it says the title of it and then the background, it gives the council some background about it. At the very end of it, I see it says the attached policy, will require any public event held at any MCA facility that will require the event coordinator to check that all participants show proof of vaccination prior to attending the event. Can I get a copy of that that policy that was supposed to be attached but wasn't?
Yeah, there's not a policy, but what happens is that when events are occurring within the MCA or at the facilities, they're required to go through the EOC to submit an event plan. So there is a template through that, and the EOC will then review the submission to make sure that it's compliant with all of the required directives. So we can take a look to see if that template is available. There's not a policy per se on that.
Okay, and this is a point of, I don't know what you call it. If in fact the council received something from the executive director saying that there's an attached policy, I don't understand why, that wasn't questioned by anybody, or that wasn't removed, that wasn't. I just don't understand, Abram, why somebody wouldn't have gotten that policy, or, if it says it's attached.
Well, I will say, and these are only submission forms. In fact, they're not even, the decision and the directive is either on the policy that's being accepted or the resolution itself. So unfortunately, it's not uncommon that some errors are made in the submission forms. It's where the directives or the acceptance of the policies themselves, we want to make sure that they're not. But yes, noted, I understand what you're saying.
Thank you for noting that and understanding what I'm saying. The other question I had was also, notes I'm taking. Where can I, for some reason, when I was like getting ready for this meeting tonight, I saw somewhere, and maybe you can help me to that said attached are the council chief's activity reports for some month. I'm not sure which. Where did I see that? Can you help me with that?
I don't get the emails that go to the community with relation to the material, but I know that when the link was sent out and the link for the Zoom and the link for the material on the website, there should have been an attachment on that email with the monthly reports of the members of council, including myself. So if you didn't receive that, again, in the morning, we'll send out the information again. We'll make sure that those attachments are on there.
Yeah, no, I started reading it, your section, and it said something about you guys attended some kind of team building exercise about personality and how you can, how did that go? Just as, how did that go?
Well, this is the personality dimensions. It's a training or a course type thing. It identifies kind of what color you're associated with and what those colors traits are. I think it went well. And as I reported in my report, you know, it's important that we understand how each person that we work with personality is and what those generally expectations are of that individual so that we can better form together as a team. So I think that it's went well. Sometimes people think these things are a little geeky, but I can tell you that every time we have this training, our staff and members of who's been trained on this do embrace what it is. So, you know, while you're interacting with somebody, you know, I've heard of situations of walk away and say, well, they're a blue, so I know that's, or they're an orange. That's how, you know, that's how orange is. Not that, and it's not in a negative connotation. It's clearly to be understanding of how people's personalities are and why sometimes they may take longer to answer a question or may jump fast to a conclusion or what have you. So, I mean, I think that that's a good exercise. It is used by people. I have seen it over the years that it does help.
What color do you guys think I am? Only carry.
I'm not sure that's a fair question for this evening. We'll have to have a conversation.
Yeah, please don't waste your time on that. And I can't believe you haven't done it already. But I just want to say this. The last thing I really want to say is I want to thank the council members for continuing the heating assistance program. I think it's really, really needed right now. Okay, thank you.
Thank you very much for that. And we do know that definitely appreciated program for the entire community. So, and Yamagoa for your questions as always. Connie, we'll go to you. I see you have your hand up and then we'll go to the next hand.
Okay. One of the things, since you brought up that personality exercise you did, I just wanted to say that one that is completely worthwhile is Crucial Conversations. Sure you've heard of Jim Manoa and some of his teachings. It's something I think council and management should really look into. When we joined AMBE, we were able to access the training, and it is so worth it. Like, I can't express how good that program is and how well Jim Manoa provides the training. So if you're going to do anything and you don't want to feel like it's wasting time or, you know, it's kind of silly, he's worth investing in. My other question, or well, that's just a comment. My question is about, I've noticed that the COVID-19, when they're doing the statistics, we know of members who have passed, yet the death rates aren't changing. And the other one was, you know, you're really going hard on the ones who aren't, and I said this, I think, at the last meeting, who aren't fully vaccinated. But please keep in mind, vaccinated people can pass COVID-19. They can catch it and they can pass it. So, you know, you talked about Ford and how you don't know what March will bring. Well, if, you know, look at the state side, they jumped right on board with not wearing masks because they were fully vaccinated and everything's exploded. So again, I just wanted to ask the question about the death rates, and then please, I know as the individual, I don't want to be told what to do with my body. So again, but I've chosen to be vaccinated. So I think that there might be an easier way, because like we're almost villainizing the non-vaccinated now. You know, now they are being limited. They are being discriminated against, and we may think it's in their best interest, because we don't want to catch disease, but please keep in mind, vaccinated people can spread COVID-19. So so my question was about the death rates.
Yeah, so thank you for that. We acknowledge that this is an ever-changing, and that yes, there is people who still continue to choose to be not vaccinated, which is obviously their right, and we want to respect that as well. We are relying on the science around this. We're not scientists and not able to quantify it, but it is a touch and go. There's no doubt about it, and this changes fast. We've been in this for 18 months now, and we have come a long way from not going anywhere and not knowing to knowing a lot more, but there's still a lot that's not known. As far as the case numbers go, or including that, ensuring that the unfortunate that the deaths are included in there, we'll look after that as well. I know that some of the numbers are not updated as fast enough as they should be, and this is a bit to the conversation we had earlier about ensuring we have accurate information, well, not accurate information, but accurate data for homes, but also ensuring that we're reporting that it adequately. We're going to be ensuring that this is being investigated and looked into, and making sure that the community has up-to-date, accurate information about deaths, about vaccinations, about unvaccinations, what have you. We're working through this. So I want to just thank you for that. And your comments about the unvaccinated, thank you for that as well. This does not, I can tell you that every conversation around vaccination, the use of our facilities, staff, has been very long conversations. Every member of council has weighed into these discussions. It's not been an easy conversation, but we are, again, these are where we are right now. Will these be in place forever? I can't say yes, and I can't say no. It will continue to change as the climate, as the science comes in over the next several months, and hopefully, at some point, we're all very tired of this, but we need to continue to make sure that, we're doing the best that we can to keep our community safe. I will say that, in the conversations that I have had with regional partners, including the Cornwall Community Hospital, they are seeing an increase in our members going into the Cornwall Hospital and requiring, acute care, which is essentially going into the ICU. So it's, it is very troubling to see. Our people generally are very vulnerable in the health sector, and it is troubling to see that our numbers are have been going up a bit. They are leveling at this point where we're at right now, but science has shown wearing masks, that the vaccinations do have an effectiveness as well, but also social distancing and staying home when you're sick do help. These are measures that have been proven to help. So we really can't, we can't put our guard down. We just have to continue to do our part, even as much as we're so tired about it. But thank you for your comments on that. Are there, we'll go back to you, Vincent.
Grand Chief, I believe Toby Mitchell's had our hand up.
Oh, my apologies. Yes, Vincent, give me 1 second. I did, Toby did first. Toby, we'll go to you, then we'll go to Vincent. Or she's just gone. I think she is gone. Okay, Vincent.
I've lost another constituent. Anyway, I'm asking the council to, I know events in MCR just came out, and I know there's I just saw it a minute ago, something about the chief electoral officer has said something because of that policy that people can't go in and nominate people if you haven't if you haven't been fully vaccinated. I'm asking the council to really take a look at how we can allow certain activities that are really rights that we hold to be really important in the community, and that are like in, especially one of the basic laws that we have, which is our membership code. I know it doesn't probably specifically say we have a right to nominate people, but what's going to be coming right around the corner after the nominations is the voting. And I'm really asking you to put your brains together and figure out how we can, like what Connie Hall was just saying, how we can allow people to still exercise some of their basic rights and access to certain activities at the same time that we're trying to be safe with each other and protect each other, because it's a quick and slippery hill that we can slide down if we're starting to take certain rights away from people. So, you know, even the idea, maybe just thinking is that people would be given a paper, they put the nomination stuff on there, everybody's wearing masks, and it's put in, you know how you put it in, I don't know if for nominations, like how you could do it so that you could get a nomination from an unvaccinated person, and for some reason the chief electoral officer uses gloves or something so that it minimizes the risk involved in reading that nomination or something. Have you guys discussed that?
No, we haven't. I mean, that I think that that decision does fall in line with the decision to use the facilities, but we'll have to have them take a better look at that, because in Canada we've seen that, well, of course, vaccination using facilities is brand new, but in Canada they just went through an election safely. And I would almost, now this is not council's official position, but I would almost equate, you know, going in to nominate or vote the same as going into a restaurant and picking up your food, whereas you can't eat in the restaurant. This is Ontario, but you can go into the restaurant and pick up your food if you're not vaccinated. So I think that there may be too literal translation on this, but we will take that information back, and you know, the people that you know, make those interpretations and determinations, we'll ask them to take a better look at it.
Yeah, and just the wording, I mean, if we want to be literal, I think it says something about in MCA facilities. So if there was something where you could help, you know, you could let them nominate outside in the parking lot or something like that, right?
Yeah.
I think if there's a will, there's a way. And I just want to protect people's rights, and I'm sure all of you do as well, you know?
Yeah, no, absolutely. Thank you for raising that, and we will follow up. Kristen, I think you had your hand up. We'll go to you, and then I see Jackie, and I'll go back to Connie.
Hi, I was just wondering about the new COVID policy for employees, and like, I understand where it's all coming from and keeping everybody safe. It's obviously like the number one concern of everybody. But I was just wondering if there could be, I guess, like an explanation could be provided on how the policy was developed, as like as Connie was saying earlier, you can still catch COVID and you can still spread it if you're vaccinated. So the policy states that if you're vaccinated, you don't have to wear your mask, and you don't have to submit to weekly testing. But if you can still catch COVID and spread it, then I just kind of don't understand the logic behind it. Whereas, like, if it's for the safety to spread it and keep everyone safe, shouldn't everybody have to get tested every week and everybody still wear their mask, because everybody can still catch it and spread it whether you're vaccinated or not? So it just kind of doesn't make sense. And I was just hoping for some sort of clarification on how that was decided upon.
Yeah, thank you for that. So the recommendation would have come from our administration that this be implemented for the staff. I mean, the direction of the workforce is under administration, but at the same time, the development of the policy would have been likely done in consultation with legal counsel as well as health professionals. As I mentioned earlier, that the federal government has now made this mandatory. Many other workplaces have made this mandatory. We do know that there are people that we interact with that have indicated to us that if we don't have vaccinated, all people participating in meetings have to be vaccinated as well. So it's not uncommon. There are some resources that would have been used to be able to in the development of this policy. In principle, council was supportive of the policy itself. Now, exactly how it's administered, we would not have been involved in the authoring of that. So if there are areas that need to be modified, then administration will make those recommendations back to us. Also on how long this will continue to be in place, administration will make that recommendation to council and they'll determine, if it's going to be removed or not. So the technical of it all, we were not involved in. Council agreed that the initiative or the policy was what we were supportive of, and the administration developed it from there.
Okay, so like I said, I understand how it all, like you're saying, it's all developed and implemented and you are approving it to be implemented based on these recommendations. But just you personally, do you think that makes sense though? When you're reviewing this to decide if it should be approved or not, did anybody question that? This doesn't really make sense. Maybe we should change it, or we should, you know what I mean? Is it just black and white? This is what's presented and things can't be changed and tweaked just because that's what everybody else is doing? Isn't that kind of what the big change in MCA was, kind of, 2016, the big push, let's not just do things the way we've always done them. So I'm just saying, there's, like Connie was saying, there's a lot of people. You just put out the stats. There's 28% on the MCA jurisdiction that are vaccinated. So that's almost 3/4 of people that aren't. And then how many of those people work for MCA, individually, that are going to have to be, abiding by these policies? And I get everything and I understand it. I just don't think that it makes sense that if it's really about safety and doing all these things, which it is, I think that it should be consistently enforced on everybody. It's because it's, if someone's not vaccinated and then they go to work and they are around somebody who is vaccinated, those people have I don't know the stats. I mean, I'm sure if they're even out there yet, but it's the number of people that catch COVID that we're told every day in these daily updates, what is I'm sure that some of those people are vaccinated, and that's proof that there are people still catching it. I just don't think that it should be everybody get tested and get, wear your mask every day, because we can all still catch it and spread it. And that's what we're trying to stop. I don't think that you should just be enforcing it upon one group of people.
Yeah, well, I'll just say a matter of process. So when the policies or resolutions, which accept policies and resolutions do a number of other things as well, come forward, council receives them, and several days ahead of time, in fact, on a Thursday, prior to the Monday morning meeting, it is the obligation of every member of council to read through that material and question whether or not, if they have questions, to question at that time on Monday or leading up to Monday. And then based on what the information has been provided to them, if they're comfortable, then that's how they'll exercise their vote. So every member goes through that. And I can tell you that well over 80% of the members of council supported the resolution. The ones that didn't stated their reasons, but obviously they have that ability to do that. You know, so I acknowledge what you're saying about, we want to do things differently here. But, when we're talking about a virus that, potentially, can be harmful or has been harmful to our community, council has said that we will follow very similar to what other organizations are doing to keep their workforce and their community safe.
But that's like saying that everybody else is doing it right.
We have to rely on the science, and we're not scientists here. So I know that breakthroughs do happen. There's no doubt about that, but the science has also showed that those who have contracted the virus who were vaccinated were not affected as strong as people who were unvaccinated. And I can tell you that talking with the Cornwall Community Hospital, as well as listening in on some of the regional calls, majority of the people who require ICU services are unvaccinated. There are a few, yes, in there that have been vaccinated, but when you look at stats that says majority of people who are not vaccinated require ICU, that's startling, right? And we don't want any of our community members to be in there. And unfortunately, we have had our fair share and will continue to have our fair share of members who have needed to be in the ICU. And frankly, majority of them were unvaccinated. So, I can't say that, 100% that being unvaccinated is safe or it's, unsafe or what have you. But when you see numbers startling like that, you have to, do your own analogy of it. Thank you for that. We'll go to Jackie, then we'll go back to Connie.
I just wanted to go back to the previous question about the MCR that just came out recently, and the notice about nominations and voting. When I saw it earlier, I was surprised myself. I didn't know that was going to be part of it, and I think maybe we need to look at more options, because I really don't think we thought of that. I know I didn't. I'm not going to speak for everyone else, but when we had our elections for council this year, did we not do drive-through voting? And membership board nominations are coming up this Saturday, and not sure when the voting is going to be, but I think it needs more discussion. Excuse me. And the other thing about the policy, yeah, we have, we have the policy concerning employees. Now we have the one about the buildings. And there's been a lot of discussion about these policies. And, it's hard to make a decision for the whole community when it's our duty to protect the whole community, not, and my thing is then it's our duty to protect the whole community, not just the ones who are vaccinated. That's just my feeling. I'm not speaking for anyone else here. And, when it comes to the safety, and we want to do everything we can to protect everyone. So, there are people who are affected either way. I didn't get the vaccine right away. I hesitated, and I ended up getting it because of the fact that if you're vaccinated and you can still get COVID, then you can, hopefully the effects will not be as bad as someone who's not vaccinated, but that's still a personal choice, and we can't tell people how to live, So some of these are hard decisions, and there's lots of debate, lots of questions. And That's what I have to say about that. Thank
Yeah,
you.
Thank you, Jackie, for that. Connie, we're going to go to you, then Vincent, and then we're going to wrap up.
For that, Jackie, because I was gonna note that I hadn't seen your answer or Ryan's answer when council was asked. Sorry, I just ran up the stairs to get if you were vaccinated. So I was curious because again, this MCR passed has so many things are going to happen because of it. So that's why I wanted to make sure that all of council, you know, if you're going to say all staff have to be vaccinated or all community members have to be vaccinated, then I hope that all council is vaccinated. Now, I can't tell you to get vaccinated, and I wouldn't, but I would like to know. And I forgot my second part of my question. So again, I wanted to just find out for sure if you are all vaccinated.
You know, I wasn't sure if I was going to answer that question either.
See,
You know,
it's hard.
And
hard.
And you're right about that. It is hard. And
I have no business knowing about your health. But this is what you're asking all of our community members. So, I mean, just think about that. Again, I'm no saying I made my husband get the vaccine, but it took me all this time before I finally said it's limiting us. Not getting that vaccine is limiting us as a family. So, and it is putting us at risk for something worse to happen. So I am an advocate of the vaccine, but again, if it's your choice. Yeah, so again, Ryan, I didn't hear if you had yours.
yeah, and I'm not sure if it was you or someone else who was asking the question and pointed out that we have no end dates when really, you know, the reopening phases through Ontario are going to be, well, it's the proposed plan to be fully reopened in March, but we didn't consider that in the policies. Well,
Yeah.
when the policies were made or whoever made the policy, I'm not sure if that came up at all. I wasn't involved in that, but I'm not sure about that, but it's a good point to make too. So thank you.
I just wanted to add before you go on that getting that little code is not that easy. So I found out at the Heart Institute how actually impossible it was. So I ended up finding out how to get it. But you know, you say get that code, get it, put it on your phone, do this and do that. It's not that easy. And someone who's not techie or doesn't know even have how to check their email, that community member is not going to know how to do it. You know, so again, you're putting limitations on people who probably even have the vaccine, but they might not have that code, you know, or that moment they don't have their card on them with it written, you know. So again, just bringing that up for discussion.
No, we're well aware. I mean, it's you know, I mean, our geographical location has not helped one bit in the whole pandemic, right? And that's you know, the QR code is part of Ontario and part of Quebec, and you know, majority of our community is vaccinated in Ontario, but 2/3 of our community has Quebec health cards. So it is a quagmire that we're working through. There has been a email set up at the health department for individuals to reach out to, and they can also give them a call. They can help walk through those issues with them. But so far, the MCA ones continue to be accepted. The code is just a really fancy way of verifying, but the paper still continues to work. So, Vincent, we're going to go to you.
Thank you, sir. On that topic, what do you think Because I saw a lot of people in lines because they couldn't wait for the Canadian side to get going and they wanted their vaccination. Do you know what percent of the northern portion got their vaccinations through the tribe?
We don't offhand, but we do have that data. So I'm not able to report that right now, but we can share that.
But it's a good chunk of people, right?
Potentially, yes. I mean, there's a bit of, I mean, that in itself too, I mean, I think is a bit debatable because how many people report that they went there, got their vaccine, and that they live on the northern portion? If you said you live in Roosevelt Town or Hogansburg, you know, they're likely that data's in the Roosevelt Town Hogansburg data bank, not in the northern portion.
You're correct. Okay. The other thing, when Christian, is Christian still on? No. When she said that, you know, as far as she was saying something about the fully vaccinated won't have to wear masks anymore. I don't think that's the case. I think the policy says everybody still wears masks when they're in like public areas where you're coming across with another employee or somebody else. So I think everybody's going to wear a mask. But I do, one of the things, Abram, that and I've told you that I respect you and stuff like that. But one of the things that really bothers me is, and you've said it a few times, sometimes, you know, on the radio with Reem, and you're coming on the radio next week again.
Yeah.
It bothers me that you make such a you make these differentiations between council, the group of chiefs, and council, the administration. And I know that certain things you delegated to the administration, and it's the role of the administration. But when it comes to one of the things that you said this evening, which is, and I'm paraphrasing, and I'm not going to do you justice, so please forgive me ahead of time, but one of the things that you kind of said is that, you know, we didn't really have anything to do with developing the policy, and that may be true, but the buck stops with the council, you know? And so and Christian was saying a little bit of it, and maybe a little bit from Connie, is that no matter who develops that policy, you know, or if you're even copying a policy from the federal government or Ontario government, Quebec government, or the US Constitution or whatever, as soon as you guys sign your name off onto that and you vote for it or you vote against it, you're taking ownership of that. You agree with me?
Yes, absolutely.
So I don't know why it bothers me so much, but I know you've said it to on the Fedor Fowler or those special things, and I listened to your words. And so I don't know if you're going to change at all, but I think you represent the Mohawk Council of Akwesasne organization and the Mohawk Council of Akwesasne political governing body. And so when, you know, I think you just have to take ownership of the fact that that's your policy. It doesn't matter who developed it, if it was administration or whoever. And those are just some words that have been on my mind for a while. And I'll be looking in the future on how you're a very good wordsmith and you're a very good presenter, and you know the Mohawk Council very well. And I appreciate the fact that when you don't know something, you say you don't know something. you know, that takes that takes a very honorable person to be able to do that. And I don't know if I'm making Dwayne laugh like a crazy person or what, but my words are always
Well, I appreciate that, and you don't come off as a crazy person at all. And you're absolutely right. The buck does stop with council, but you know, I mean, we are not administrators. Our job is to be the political bodies of the organization to represent. You're absolutely right. When we do accept something, we have to take ownership of it. And I have never, if I've come off that I'm not taking ownership of it, I apologize, because I do know that, you know, that council has accepted it and I take the brunt of it, and I have no problem with that, or I will execute it, or I will share that information. That is my job as the Grand Chief. Now, I talked a little bit earlier about process and how, you know, all of these resolutions go to members of council. All of these members of council should be looking through this stuff. If they choose not to, that ultimately is up to them. As the Grand Chief, I can't make people read these documents, right? So, I mean, so if people are not comfortable with it, they need to speak up. If people don't understand, they need to speak up. But at the end of the day, it's my job to facilitate the discussion, decisions, and decisions are made on the resolutions. And I stand by them until they have been altered, rescinded, or, you know, reversed. That is the position of the Mohawk Council. And I appreciate all of your insight, your compliments, and also, you know, where we can improve. I'm always looking to make sure that we are doing the best that we can, but also living up to our responsibility and our fiduciary responsibility to the community and to the organization as a whole. So, you know, Julie, we're going to go to you.
I think Grand Chiefs mentioned this a few times during this meeting that, you know, I'm kind of getting the impression, and maybe it's not so, and maybe that's not the way it's meant to be said, but, you know, we don't just finally rubber stamp these documents that come in front of us. We read them, we've debated them, we've gone up and down sideways on some of them. Do we always agree? No. Do we always look at the best interest of the community? I believe we do 100%. This MCR about vaccinated and non-vaccinated was a tough one. I don't look at this MCR, at this policy, as being a policy against non-vaxxers. I looked at it as us being responsible for their safety as well. And they also need to be protected by not being in large gatherings, not being, you know, around those that are vaccinated as well. Because as you have said, vaccinated people can carry this virus as well. We all still need to wear our masks. You see the differences everywhere, right? Because of our location, you see the differences in the States compared to Ontario. I was in Quebec City 2 weeks ago, and, you know, there's a difference there too, you know, no mask when you're in public and such. But when you're inside a place, everybody masks up to leave the table to go into the other room. So, you know, those types of things, I can tell you 100% that we as council debate those things. We look at it seriously, and we look for, you know, we have to look for the bigger picture of everything. Is it going to make everybody happy? No. I've known for years, being in this position, that I'll never make everybody happy. But it is on us. There's nobody else that you look at when something goes wrong than this council, or when, you know, once or twice, you know, we get a good job for doing what we do. But I just wanted to say that we do look at them. Is there parts in there that may be changed? Yes. And as an employee, you have a responsibility to bring that up to your managers, to your supervisors, to bring it to the next level and say, we don't agree with this. And things can always be adjusted. You know, go on.
Thank you for that. Connie, we're going to go to you, and then we're wrapping up for the evening.
I should write things down. I didn't get an answer from Ryan. And the other
gave-
thing was,
He gave a thumbs up most.
okay,
often.
sorry, I missed it.
Yeah, I put a virtual thumbs up.
Thank you. And then the other thing was, is this something that could be put back on the table for discussion?
Anything's possible, yes. Whether or not it's going to be reversed anytime soon, I don't know. I mean, I think that, you know, we're relying on the information, the data that we have. This is this forever? Again, I would say no. When will we remove some of these restrictions? I'm not sure. I will say, you know, it has been like this from the beginning, from the pandemic. We were chastised for the travel limits. We were chastised for the curfews. You know, we were I mean, but they were modified going along the way. They were removed going along the way. So this is just another measure that we're using to keep the community and the workforce safe. We are a service provider. People come to the Mohawk Council to receive a service, and we want to make sure that we're providing the best service and the safest service as well. So
That means letting people through the door. So again, and it's just for, like, again, it just seems so sudden, and like now you're seeing some of the ramifications of it. So maybe just a little fine tuning, or
you know, the hard part is too, though, is that if our vaccination rate was 80% like it is in other places, then we can start removing these things, because then we can comfortably say. But when they're not, that's a real challenge for us. You know, like, we do have people getting very sick, and we pointed out that the deaths too. This is real, you know. I mean,
yes, and in my opinion, we shouldn't even be at work. The safest place is at home.
Yeah, well,
Nobody likes that.
We got
But
we got chastised for that to the max too, because people were saying, calling me regularly saying, so and so's not, how do you know so and so's working? It's not my job to make sure they're working, but you know, they're out and about doing this. Not my job to make sure, but like, I'm telling you that, you know, the pandemic has put us through a lot, and we've gone through, it changes quickly too, though. You know, I mean, if this disease can be eradicated in the next, you know, 3 to 4 months, and we're back by July of 2022, and it's a memory, we're in good shape. But if it's not, then we have to continue to put in measures that will keep the community and our workforce safe. It's not fun, right? I mean, I sit back and think, you know, when all the employees went home in March and April, we thought, oh, it'll be a couple weeks and people will be coming back. You know, this is pretty cool. Well, it's not cool and it's not fun anymore. So it's, you know, we're just managing the best that we can based on the most accurate information that we have from the professionals. So thank you to all of you for your information, for your sharing, for your insight, for your questions in relation to the pandemic, the policies that we have in place. All of you tonight identified some areas that have either gaps or areas of concern, and we'll take that all back and do our best to address this. I mean, we are, you know, the saying has been from the beginning, and it absolutely continues to be that we're all in this together. We're not trying to make any one group of people feel like they're not part of this community, any group of people not feel like they're welcome in the MCA. We want to be able to continue to provide the services to our community, but we also want to make sure that people are safe, and we're doing the very best that we can at our table and within the whole entire organization of the MCA. So thank you very much to all of you. All right, I'm going to now read a resolution just for the record as a matter of accepting the minutes from the last general meeting. To accept and approve the attached council meeting minutes dated September 23rd, 2001. Could I please have a mover? Moved by Vanessa, second by Joanne. Discussion on the resolution. Question has been called on the resolution. All in favor? Any against? None against. It's carried. All right, thank you very much. We have not announced the next general meeting date simply because it would normally be on the last Thursday of the month, and everybody knows that that's American Thanksgiving, so we're going to be looking at, we'll be making an announcement very shortly whether or not that's going to happen on that date or if it happens a week or a day before that, but it will be announced. There will be a November general meeting. The date hasn't been set yet. The district meetings will be occurring as well. Those dates have not been set as well. So that brings us to the end of our agenda. I want to thank everybody for joining us this evening. Very good dialogue, lots of information shared. We will follow up with you on those questions that were raised. Also, we will make sure that the material is shared again tomorrow to all of your emails. This recording will go out to the community in a couple of days, but otherwise, thank you very much to all of you for joining us this evening, and we'll see you in about a month's time, and I will be on the radio next Tuesday providing an update as well. So could I have a motion to adjourn, please? Moved by Edward, second by Dwayne. Thank you very much, all of you. Have a great evening.